the use case here is I'm a researcher or clinician interested in a variant from a cancer patient and want to determine what drugs have been used to treat that patient in the past. So in this case, let's just keep it very high level. If my variant of interest is V600E and BRAF, let's say for example's sake, I'm interested in only in melanoma patients who've been treated with particular compounds targeting this BRAF mutation. The place in the categories to get this type of information is one of two places. The first is if you don't know what you're looking for, the significant terms category here will highlight a number of different terms that are recurrently mentioned in the 4,500 articles that talk about BRAF V600E in the context of melanoma, many of which you can see here are specific compounds. So if I highlight those after picking them out from this palette of different recurrent key terms and perform my search, that will filter those 4,500 articles and prioritize them in list form to focus in on the content that most specifically talks about those different treatments. Similarly, if you already know what term you're looking for and you'd like to perform the search explicitly, I'm switching now to advanced search. If I say I'm interested in vemurafenib, I can perform the search by typing in free text in the abstract search here, and now my focus from those 1,500 articles is specifically on articles that talk about vemurafenib in the context of BRAF V600E mutated melanoma.